Dr. V. Suresh Babu, Senior Consultant Nephrologist working for Yashoda Hospital, Secunderabad. In this session, I am going to speak on pedal edema. First, let us know what is edema. Edema is nothing but the swelling of part of the body or entire body. So this edema is because of excessive accumulation of the fluid in the tissues, or it could be due to the injury, tissue injury. It causes inflammation and causes the edema. So now let us talk about in detail about the pedal edema. How do you check the pedal edema? Before that, I will tell you what is the pedal edema. Pedal edema is medical term used for the swelling of the part of the foot, ankle, leg. Sometimes it may extend up to the thigh. How do you know that you have an edema? The skin becomes shiny, stretched out. Your shoes, socks may be very tight, difficult to fit into. When you press, you may notice pitting. You may feel heaviness in the legs. And when this edema is very severe, you may not able to move your legs. When do you see a doctor when you notice the pedal edema? If you notice this swelling of one or two legs, you need to consult a doctor and it should get thoroughly investigation what is the cause of the edema. Whenever it is associated with breathlessness, heaviness in the chest, or any other associated abnormality in your health, you need to rush to the emergency to rule out any significant medical condition. If this edema is confined to one leg, it is called unilateral edema. Suppose if it is involving both legs, it is bilateral pedal edema. If you look into the causes of this unilateral pedal edema, first is cellulitis. Cellulitis is nothing but infection of the leg. It usually very painful and a rapid swelling take place. The second cause is venous insufficiency. When the veins ineffectively pump the blood from the leg into the circulation, it may causes the swelling. Or when there is a clot in the blood vessel, that also impairment of the drainage of blood causes the edema. Other cause is lymphatic obstruction. The lymphatic obstruction could be due to some worm infestation known as Wuchereria bancrofti, commonly known as Elephantiasis. Or this lymphatic obstruction could be tumors involving the leg. Rarely, it may be the complication of the radiation therapy. Radiation therapy causes the injury to the lymphatics and leading to the edema of the leg. When the edema takes place to the both legs, it is known as bilateral pedal edema. The causes of bilateral edema could be mild causes or the bilateral edema with significant underlying causes, or it could be to the drugs. When we say it is a mild, that is not harmful. That means when the people have overweight and then when stand or sit for a prolonged time, it may cause edema of the both legs. The other important cause is in few women just before the menstruation. That is called premenstrual edema. This is also not harmful. The other causes for the bilateral pedal edema are commonly drugs. The common drugs which can cause the bilateral pedal edema are the painkillers. That group is known as non-steroidal anti-inflammatory drugs. The estrogens, steroids can cause the bilateral pedal edema. Even sometimes the drugs prescribed for the blood pressure, particularly calcium channel blockers, also can cause the edema. Few diabetic drugs, particularly thiazolidine diones, can cause the pedal edema. The other important significant the cause of bilateral pedal edema are the underlying significant or serious medical condition. They include heart disease, kidney disease, the liver disease, sometimes severe protein malnutrition. Suppose in case of the pedal edema due to the heart failure, these patients usually have severe breathlessness and other features of heart failure. When it comes to kidney diseases, along with pedal edema, we can notice there is a swelling around the eyes particularly. Of course, in the severe cases, these patients may have associated other features. If you come to the liver disease, along with pedal edema, there is a distension of the abdomen. In fact, the swelling of the abdomen, that is accumulation of fluid in the abdomen, occurs first in the liver diseases. When there is a protein deficiency, the malnutrition, there are two reasons. One is inadequate intake of the protein in the diet. That's the one. The second is they take normal protein, still they may have the protein deficiency. This is because of the malabsorption of protein from the gut, what is known as malabsorption syndrome. Once after this, if you come to the treatment part, the treatment includes two aspects. One is the symptomatic treatment. The second is the treating the underlying condition. So first, if you consider the unilateral edema, the cellulitis needs the urgent prompt treatment with the administration of antibiotics and in severe cases, surgical treatment. Of course, the elephantiasis, which require anti-worm treatment. And if there is the edema due to the clot in the vessels, they require like a blood thinning medication and other supportive care. If you take bilateral edema, that means edema involving the both, in mild cases, they do not require any treatment. Usually, they themselves go away over a period of time. Or if you take the mild precautions, suppose if the edema is due to the prolonged standing and the prolonged sitting, you can avoid these type of habits, so the edema will come down. Still, that edema is like here causing heaviness, we can keep the legs little up, the edema subsides. The next is the pedal edema with a severe underlying medical condition. They require thorough evaluation, prompt treatment based on the cause. Suppose like the congestive heart failure is the cause for the pedal edema, the decongestive therapy and cause of the heart failure is require further evaluation and should be treated accordingly. The same in the like a liver disease, kidney disease, they require thorough investigations and require the treatment to eliminate the cause. The symptomatic treatment of the bilateral pedal edema includes the diet and some drugs. The diet consists of intake of very low salt, probably 2 to 4 grams per day should be taken, should be restricted strictly. The other important precaution is taking less liquids, should be restricted less than 1 liter if the swelling is severe. These two things must be followed to reduce the edema of the feet. The drugs can also use to reduce the edema. The usual drugs which are used to reduce the edema are what are known as diuretics. The commonly used diuretics are the furosemide and torsemide. Thank you.